As we mentioned earlier, about 15,000 nurses in Minnesota went on a 3-day strike this week. Now, that strike included nurses at St. Luke's in Duluth and Essentia Health in Duluth and Superior. At issue are wages and staffing levels at local hospitals. Joining us now is labor relations expert Jannifer David, Associate Professor of Human Resource Management at UMD's Leibovitz School of Business and Economics. Jannifer, thank you very much for being with us. The nurses' strike here in the Twin Ports and in the Twin Cities certainly got a lot of media attention.
Yes.
What did that strike signal to the hospitals?
Well, the contracts expired, so there are 15 contracts in play right now across the state. So, and then they all expired end of June, beginning of July, in that range. And so it was really a signal to all of those hospitals that the nurses are serious about what they want. It was short in nature because nurses, of course, recognize the cost to their patients for this kind of thing. So it wasn't meant to be some sort of long-term extended event. It was just meant to send a signal that they've been negotiating now for since April, and they haven't reached conclusions yet.
How big an impact do you think COVID-19 had on where this situation is today?
I think that's one of the interesting pieces of this, is that staffing seems to be the biggest issue here. And large problems with staffing is not the fault of the hospitals or the nurses, right? So what happened with COVID-19 is that a lot of nurses have reached a high level of burnout. So there's been a much higher level of turnover in the nursing profession since the pandemic started. And coupled with, of course, a higher need for hospital care. So you have, this growing gap. And to be fair, the truth is that we expected a shortage in nursing before the pandemic because there were lots of nurses who were reaching retirement age before the pandemic even hit. And so lots of those folks have chosen to retire earlier.
Why was the strike limited in scope, just 3 days instead of being open-ended?
Because nurses at the core of their being, right? Nurses want to take care of their patients. And 3 days is enough to send a signal, but it is it's painful for nurses to be on that line and know that their patients are in that hospital, right? They don't want to create those disruptions for them.
You mentioned that the staffing shortages were kind of on the table even before COVID-19. So can the strike make any difference in terms of how hospitals are staffed if they just don't have the personnel needed to staff the way the nurses would like it to be?
That is a struggle, right? And I think that one of the things that one of the messages the nurses were trying to send was we have to start getting more creative about those solutions. And I think some of the hospitals in this 15 group of hospitals, I think all of them agree that we need to come up with creative ways to get more nurses to come to work, but that these are very difficult jobs. You're looking at acute care nursing where people are very sick. These are hard jobs to do.
During the strike, was there a higher risk to patient safety?
I wouldn't expect so, no. I mean, all of the hospitals had a significant amount of time ahead of the strike to be prepared. So they're required to give 10 days notice. All of the hospitals had traveling nurses who came in and fulfilled the needs for the patients, so I wouldn't expect so, no.
How patient is today's public with labor strikes, particularly when they do involve folks who are in some of these critical positions, like nurses, like teachers, like police officers?
My sense is that they are probably more patient today than they were a decade ago. I think that there's been slowly a shift and a recognition that there's maybe more need for some of these actions sometimes to get a little bit of a shakeup in the system. We've seen real wages decrease over time, and with the current inflation rate, that hits some groups particularly hard.
Do you think down the road there could be another walkout?
Well, I sure hope not. I don't know, right? I think that many of the hospitals involved and the M&A who are involved in this, there are dates being set to have negotiations starting next week. So hopefully those things will resolve themselves, but I couldn't say how that's going to play out.
I understand that the hospitals are asking about mediation, but the nurses don't seem to want it. Why?
I think that the nurses feel that mediation isn't useful at this time because they're too far apart, right? And I don't know if they're right or not, but right now they want to make They want the hospitals to move a little more before they might want to consider that, I think.
How did the hospitals respond to the strike?
Mostly they responded by taking care of their patients. So they were super busy, right? And so there were no negotiations happening during that strike because everyone who was in the hospital was busy taking care of patients.
Mm-hmm. You specialize in labor relations. Do labor unions still provide a valuable service today when in today's world there's so many rules governing how employers treat employees, and it's all codified into law?
Mm-hmm. Yeah, I think that's a good question. Yes, I would say they do provide a balance, right? There's an inherent difference in power between companies and employees. If an employee leaves a job, that's a life-changing event for that employee. If an employee leaves a job, the company has a whole system set up to replace them. It's not a catastrophic event for them, as it would be potentially for an employee. And so that imbalance of power generally puts management in a position to be able to make higher demands.
Sure.
And over time, we've seen pieces and parts of our working conditions erode.
And with that, we have to close it. Jannifer David, thank you so very much for being with us.
Thank you for having me.